Well, welcome, Dr. Lutz. I'm so honored and happy to have you on today.
It's a pleasure to be here, and thanks for having me. Looking forward to discussing how to heal your disc.
Yes, healing your disc. Boy, this could be the multi-million-dollar answer right here. But let's first backtrack. I really want to talk about how you became a doctor, how you decided that you wanted to work in this particular field in orthopedics, in physiatry. Maybe you can also explain a little bit of the difference because people hear those terms and they might not know that they are different. How did you decide to go into this?
When I was in high school, I wanted to be a state trooper, New Jersey state trooper. And my dad, who was a physician, he said, that's fine, but if you are even thinking about going to college, you better go now because this is when I'm going to pay for it. So I went to college and took him up on his offer. And then I just got really interested in science. I always liked science a lot. And I was a psychobiology major in college. And then I was lucky enough to get into med school at Georgetown, which was a great clinical medical school. And then, I actually talk about my path towards regenerative orthopedic medicine in the first chapter of the book. And it was really just, seeing what I really liked was the office practice of orthopedics. And I like surgery, but I just felt like it was so destructive and it was so repetitive that I wanted to be in a more broad field. And so when I was in med school at Georgetown, I had a 2-week rotation in physiatry or physical medicine and rehab. And the physiatrist had been an orthopedic surgeon who transferred into physiatry. And I asked him why. And he said, I like medicine, I like neurology, I like orthopedic practice. And it kind of resonated with me. And he said, if you want to go into the specialty, go out to Mayo Clinic. And that's how it all started. And I've enjoyed it. And I think the combination of, interventional orthopedics with regenerative medicine is the future of musculoskeletal care. And it's here. We've been practicing this now for over 12 years, and we've learned a great deal about how the body has an amazing capacity to heal itself. And drugs and surgery are usually palliative at best. They're not usually a cure. And I think that, 90% of things can be treated without drugs and surgery. So
I think that's so interesting. I was lucky to grow up with an orthopedic surgeon who had this sensibility, and he would really try and avoid, especially spine surgery, because he said, I can't remember exact statistics, but he was like, 60% will not get better. 30% will get worse, and only 10% might get, better in the terms of less pain and possibly more function. But those aren't really good odds. And yet it's still, I think, a first choice for a lot of people. So can you give an example if someone has come to you as opposed to another orthopedic surgeon who, I'm not saying all of them will do it, but are looking to go in and fix the problem with surgical intervention? What would be the difference? I mean, and this is its own conversation, but just so people can really understand, if I had pain that was radiating down in my leg and it was showing that I had some kind of discogenic issue, that one surgeon said we can just remove that disc or take out part of it, what's the difference in what you're offering?
So I think the main difference is that we're going to approach things first non-surgically. And, like the analogy I give my patients is that if you have pneumonia, they don't cut your lung out. You really want to preserve the disc if at all possible, because, the disc is really the heart of the spine. Like each spinal segment has this nice gelatinous structure, which provides, our ability to move. If we were just a single bone, we couldn't do all the dynamic activities that we do. And so the way we would approach, disc herniations is, we would do a really good history and exam, make sure that it is coming from your spine. And then we would do a confirmatory MRI to make sure that we know exactly which disc is the problem. And then traditionally we would, do image-guided injections of anti-inflammatory medication around the disc and nerve, and then combine it with the really appropriate spine rehab. And really, those injections give you windows to heal on your own. And the big paradigm shift that's occurred in my practice over the past 10 years is that we're really even moving away from using steroids. And we're really moving towards using your own cells, because your own cells have multiple functions, and one of them is anti-inflammatory, but it's also pro-healing. And so the beauty of using something that's called PRP, or platelet-rich plasma, is that it's a very high concentration of your healing cells and proteins directly where the problem is. And it's a very safe procedure with, really profound results.
How did that understanding and, I guess, experimentation begin? Was it with the body? Was it with the skin? I know it was with collagen. Where did that start? I've heard about it. I've heard people getting it in their knee and their hip.
So it really started more in the dental and veterinary medicine worlds. And I was introduced to PRP because we have a farm and we have horses, and the vets would come out and, basically take, 50, 60 milliliters of blood, spin it in a centrifuge, and then inject it into a partially torn tendon. And the once lame horse would be running around like a pony in about 3 to 4 weeks. And so when you see these very objective results with, these really magnificent animals, and it was one of the vets in Princeton area, Dr. Daniel Keenan, who said, "You should be doing this on your patients." And I said, "You're absolutely right." And so the first patient I ever did was up at HSS, Hospital for Special Surgery, and he was a 70-year-old tennis player who had a really bad tear of his Achilles tendon, but it wasn't completely torn. It was about 70% torn. And he had come into my office on the very first day I got my first PRP kit. And he had been in a cam walker for months. He had a cardiac condition, was scared of surgery, didn't want surgery. His background was he was a hedge fund manager. So he had invested in a PRP company. So it was he goes, "Why won't anybody do this?" And I said, "Well, it's new." And he goes, "I think it's safe, don't you?" And I said, "Yeah, it's your own cells." So we actually, we injected him that day. This is 12 years ago. And in a few weeks, he came back with no pain. And so I looked under ultrasound, and it looked like it was starting to heal. So I injected him again. And then he came back completely cured. And we put him in the MRI, and his Achilles looked totally normal. And so that was my first experience with using PRP on a tendon. And it wasn't hard to make the leap into the spine, into a disc, because the same collagen that makes up a tendon makes up the outer rings of a disc. And we know that that's where a lot of painful tears reside. And that's really, the number one cause of back pain, are these unhealed tears.
Unhealed tears. So can you briefly explain, because you hear this all the time, "I slipped my disc is herniated, I have a bulging disc, this MRI showed that." When people hear that, can you just, from your medical perspective, explain what are the differences of those?
Sure. So, if you think about lower back pain, there are many different causes, but by far the most common cause is a problem with one of your discs, usually at the lower levels. I would say at least 50% of back pain is caused from a disc problem. And it really begins with a tear. If you think of the disc as like a radial tire with a gelatinous core, you've 20 concentric fibrous rings which keep that jelly contained. And with, aging, injury, chronic sitting, these rings can weaken. And when they tear, the internal blood supply to a disc is very poor. So unlike your skin, which heals beautifully, your discs don't heal. And then there's now this growing data that when these discs tear, there can be an ingrowth of blood vessels, which brings the bacteria, and then the bacteria causes the disc to get painful and degenerate further, which is really, completely new information. But if the tear gets big enough, then the disc can start to protrude. And think of a protrusion as like a pimple in the back of the disc, or it can bulge, which is kind of like like a blowout on a tire a little bit. And then if it totally tears, then you get an extrusion of disc into the spinal canal, which can cause a nerve to get not just painful, but injured. And then you can also have a disc that's kind of free floating in the canal. So you think of a disc herniation as 4 types: a bulge, a protrusion, an extrusion, and a sequester fragment. And it's all stages of severity. And if you could intervene early and fix the tear, then you don't get the degeneration, and then you may not progress to a full extrusion or a sequester fragment and a nerve injury. So we're really changing the paradigm and how we think about how to intervene early, create some healing, and hopefully prevent, what's referred to as the degenerative cascade, where your disc degenerates and your spine starts to crumble.
Yeah. So on that note, I think people think of disc, think of spine, and a lot of times if there is some kind of malady, there's this sense of weakness or crumbling. There's fear. There's so much fear. And, and when you hear like I'll get somebody who's like, they get very identified. I have, L4, L5 bulging disc. And I'm like, okay, but then there's this fear of movement. There's this fear of doing anything. And I think that's why a lot of people will then turn to a quick solution like surgery, because the fear, I think, compounds whatever other symptoms are there. And it sounds like what you're doing is similar to kind of John Sarno back pain, just this. He talks a lot about how much of back pain is also inciting this amygdala, this fear, this stress response that then is like this, puts you into this cycle of fear, pain. But with you, I think what you're looking at is the body's able to heal. We just have to give it like this intervention that isn't, you mentioned in surgery, I forgot the word you used, but destructive. So when you say, I wasn't sure if you meant it was destructive for you because it's hard on your body, but when you said destructive, what is destructive about surgery versus this kind of intervention, which I think is obvious, but, can you lay out for anybody? Because I have people ask me daily, they're younger than me. I'm going to get cervical fusion, cervical this. I'm like, have you tried other things? Because this is not something you backtrack from.
Well, that's the whole point of this book, is to kind of get the word out about, really changing the paradigm away from drugs and surgery to regenerative medicine. Because, if there's one area of medicine that can offer hope to patients, it's regenerative medicine. And sometimes the solutions to such complex problems, such as chronic lower back pain, can be so elegant and simple as just taking your own cells, precisely guiding them in with a high concentration to kind of start that healing process. That's really all it is. And the safety and the efficacy has been, very, very good. And so trying to intervene early is always the key. And like you said, when you have that fear response, you put your body in that fright and flight mode. And when you're in that fright and flight mode, your threshold to perceive pain is lower. You're more aware. And it doesn't create the problem, just makes your ability to deal with it more difficult. And so I think, what patients should feel is that their spine is stable, it's not going to crumble, and we finally have a treatment that can really prevent downstream problems. And the key is early screening and early intervention. And I think that, when I was in med school, that I can remember, the diagnosis on the chart was low back pain, but that's not a diagnosis. That's a symptom. And, now we're very specific in trying to get an accurate diagnosis up front, just like any other area of medicine where an accurate diagnosis is so important. And now we have treatments that aren't a spinal fusion for patients, which are, these are just simple outpatient procedures that take less than an hour. And I think that, trying to get the word out to patients about intradiscal PRP is really the goal of the book.
Okay, so let's talk a little bit about the segments of the spine. Can you explain why there's certain areas of the spine that are more vulnerable to disc degeneration or damage or problems?
There's many predisposing factors for patients that can cause your disc to degenerate. And there's certain things that you can, intervene and avoid, such as smoking, being overweight, sitting for hour after hour without pressure relief, trying to avoid trauma like falls and sports injuries. Particularly, we see a lot of patients that get injured in the weight room, doing, deadlifts and power squats, super heavy, going too heavy too quickly, that their bodies just can't keep up, and they overload their discs and they blow it out like a tire. And so, I think that the reason the lower back is most susceptible is because there's more load on those areas with our daily activities. Plus our body weight, half our body weight is resting on those lower discs. And that's why the L4-5, L5S1 levels are the most common. And so, we're really made to move, and we're not made to sit all day. And I think that, our jobs and our electronic, devices keep us very stationary. And the pandemic only added fuel to the fire, so because everybody was home, they weren't exercising. And I think that, the foundation of any spine treatment program is always a really good exercise program. And that's something that we preach as a physiatrist.
That's great. Well, I'm right there for that. I'm really curious, how much pushback have you gotten from doctors who are taking the more, I don't want to say traditional, but just the route that you started to take, and how much are insurance companies supporting this? Because I think this will be really important for people that are listening who then maybe talk to another doctor and they might say something different. Like, has there been pushback, or are people really excited about it?
Well, there are a lot of like-minded physicians like myself practicing interventional orthobiologics. And so, I'm giving a talk at a national conference next week out in Phoenix, and how to optimize outcomes with intradiscal PRP. And there'll probably be hundreds of physicians there. But the hospitals and the physicians that rely on, drugs and surgery, there's always going to be pushback. But what's good about this is that patients realize that the outcomes of traditional treatments for lower back pain aren't very good. And, who wants to be on opioids? Who wants a spinal fusion? And I think the problem was that we had nothing better to offer patients up until we started doing these procedures and learning how well they work and how safe they are. And, it takes time for the medical establishment to change. And one of the examples I gave in the book was peptic ulcer disease. And, the big dogma at the time was that, ulcers were from stress and foods and those sorts of things. And then these physicians, John Marshall, actually noticed that there was a particular bacteria, H. pylori.
I had that.
Right.
Yeah.
And
which
so
is
H.
very
pylori,
common, and especially in other parts of the world. But yeah.
So he was preaching that he thought, because he did biopsies of the stomachs of his patients and saw this particular overgrowth of bacteria. And he was like, ostracized from the medical community for bringing out this idea that a bacterial overgrowth could be causing peptic ulcer disease. And it got to the point where he actually ingested the bacteria himself to prove that it caused a peptic ulcer. And, then 10 years later, he got the Nobel Prize for his discovery of H. pylori. And now it's really, become, the treatment is to treat the overgrowth of bacteria. That's the cure. And I think that's been the problem with, chronic lower back pain, is there never has been a root cause treatment for degenerative disc disease. And I think that, that's what I'm so excited about to share the message, is that we do have a root cause treatment. And it's a special type of PRP that we inject into tears inside the disc to promote healing. And what we've noticed is that the PRP should also have a very high concentration of your bacteria-fighting white blood cells. And so we think we're actually killing two birds with one stone. We're creating healing with the proteins from the platelets, but we're also suppressing the overgrowth of bad bacteria inside the disc that may be causing the disc to become so painful and inflamed and degenerate. And so that, I think, is something that is quite unique about what we're offering patients.
So when you've done this over the last 12 years, how do you, I'm sure, are you seeing this all through imaging, the changes in the disc after it's been injected?
And that's the remarkable part, because it's not just pain relief. We're seeing structural changes of healing of these tears or these protrusions. And that, if you can have a treatment that creates structural changes, it's a cure. And that's really what we're really very excited about. And we're continually looking at ways to improve the outcomes. Like when we did our first double-blind study, our success rate, was about 60% in the treatment group versus like 18% in the control. But now, in our latest study, we have the success rate over 80%, just by simply increasing our abilities to concentrate to higher levels using a different PRP system. And then we've also invented a very flexible catheter to place through a needle inside the disc to deliver the cells directly in the periphery of the disc, which is really where these painful tears reside. And we think that's going to really change outcomes for the better. And we're looking to do a new study with the combination of the high concentration leukocyte-rich PRP with this disc cath, which is the catheter. And we think that's going to give us really good outcomes.
That's incredible. Is there any evidence that this would be great prophylactically, like knowing that over time, even if we have beautiful posture, we're not sitting so much, there's going to be some inevitable wear and tear to that outer ring? Do you see this eventually being something you could just kind of come in for maintenance, or is that not, like, are there any, I guess, possible precautions or that can side effects that wouldn't warrant just a prophylactic use of it? Not prophylactic, but preventative. Yeah.
Yeah, I think that if we see so many patients with degenerative spines that affect their quality of life.
Yeah, I mean, it's the center, it's your center axis. Right. Everything is residing I mean, the spine in many ways, as mobile as it is, structurally needs to be really quite stable for all the different movement variability. So yeah, it's massive when that's an issue. So go ahead. I'm just
and so the longest follow-up I have is 12 years on a patient. And that first patient I treated fell off a roof, blew out his L4-5 disc, and, had severe pain, was looking at a fusion. We did the intradiscal PRP, and he's been great. And his follow-up MRI shows no degeneration at all. And I think that when I look at other patients we've treated, it really depends on when they come in to see you. And, if the disc has minimal degeneration with a tear, it's easier to treat than a disc that is really flat, like a flat tire. once it gets to that point, then there's not much we can do. So I think right now we're only treating patients with, moderate to severe pain that's been refractory to conservative care for more than 3 months. But your point is a good one. And I think if people are starting to have symptoms of back pain, what's the harm? Get an MRI, let's look at it and see if there's something we can do to intervene early to try to limit the downward degeneration that usually occurs when the disc gets injured. And then, combine it with all the health things. There's a lot about the microbiome and the gut disc axis, with patients, so really looking at nutritional strategies, exercise strategies, don't smoke or cut back on your smoking at the very least, because studies show the more cigarettes, the more disc degeneration. It's really linear relationship. And then, don't sit all day, get up, move around every 30 minutes, just pressure relieve. And I think, so what's nice about this is you are preaching health, wellness, and, we're moving further and further away from drugs and surgery in our practice.
I love that. You were starting to mention some things, but are there any other recommendations to keep the spine healthy? Obviously not sitting. You were mentioning not smoking, watching weight management, because more weight is going to put more pressure. That's just, it's putting more pressure on your joints. That includes your spine. But any other tips in terms of or maybe moves you really like or moves to avoid, if at all possible?
I really like weight training, but I think it has to be, you think of the exercises that create a high compressive load with strong muscles, like a leg press, a power squat, a deadlift. I know those are very popular movements, but they have to be done in a gradual, progressive way with perfect form to be safe. And the problem I see is I see these football players in high school trying to deadlift 400 pounds, and they're like 16, 17 years old, and they've never done it before. And then they tear a disc, and then they're living with that pain. And so, I think there's things like, things that distract you, like pull-ups and, those sorts of things are perfect exercises for your spine. I really do like Pilates and yoga, but even those, like with yoga, you still have to be careful. I do see a lot of yoga injuries if patients are not instructed in the proper form, because a lot of extremes of flexion and rotation can cause maybe a weakened disc to pop. Mm-hmm. And so I see that scenario occasionally. So I think it should be done with really good instruction and again, gradual, progressive, incremental improvement is always the best way to start exercise.
I love that. Thank you. Yes, you'll have to try Lit Yoga and see how we're different in that way for sure. Let's talk about your book now. Okay, first of all, you were going to be a state trooper, and then you became a physician, and then you decided to not do surgery, and now you're writing a book. You are just a man of many talents. Because I'm trying to write a book. I know a lot of people who how did you decide to write a book? How did you do it? I guess, why did you decide to? I mean, I know why, but it's not just something you sit down and do. It's compiling a lot of information, and for you, making it palatable for people to read that might not have any idea about what a disc is, etc. So, what was the inspiration behind that?
I really wanted to get the word out on intradiscal PRP, and I think I really probably would have never written a book if it wasn't for the pandemic, because, we were shut down for 3 or 4 months. Mm-hmm. But that pandemic pause, gave me time to kind of organize my thoughts, reflect on the message. And, I worked with a great company called Scribe. I have to say, they've been great to work with. If you ever want to write a book, I think Scribe is a nice way to kind of get started, because I knew nothing about how to write a book, but it's been a really interesting journey. I think I've learned a lot, and I think what I've tried to do with the book is make it understandable. But the message is very simple. Most lower back pain is from your disc, and it's usually an unhealed wound inside your disc. And so people get wound healing, and all we're doing is trying to help that wound heal with your own cells. And then, like you said, if you can see an MRI prior to treatment and the tear disappears on the MRI, it's so convincing because it's not just pain relief. We're creating structural changes inside the disc. And to go back to one of your other questions, right now, most regenerative treatments are not covered by insurance because, insurance companies are slow to pick up on newer treatments. And so they deem them experimental. So it takes time. It takes a lot of data. And, you really, what we want to do is to do a FDA trial with intradiscal PRP. And so right now we're meeting with the FDA and looking at how many patients they want us to do in a study. And then we'll look at ways to raise money to do the study. And all the proceeds from the book are going to our research. And so that's one way to raise money. Other ways are, to have investors and those sorts of things. But if you can do a study with FDA oversight and show safety and efficacy, then you can get a claim. And once you get a claim, then you'll get the CPT code from insurance, from the AMA to go ahead and get reimbursement. And so when you think about, the process, it's a long road, and it takes a lot of grit and determination.
Well, and I would say, Pat, and conviction, because, like you could be sitting back, popping out, doing a knee every day, like 5 knees a day, and you're doing something that has a much more profound, I'm not saying, but it has the potential to really impact millions of people and without cutting them open, and that's really, that's a vision, that you have to have. And I think on this regard, for people listening who would immediately just bounce out if insurance isn't covering, what is your life and joy worth? It should be kind of priceless. I think that we need to spend money on ourselves first, our health. And because if you're not enjoying life, if you're not enjoying, if you have pain in your back, that it just can take over everything, and it really limits you, and it then starts to limit your kind of perspective of what you can do. And so I think that's priceless. That being said, are you looking to recruit people for this study?
Yes, eventually we will. Once we get, we're in that process of defining the criteria and also the number of patients. And so, and one of the reasons I opened RSI, which is the Regenerative SportsCare Institute in New York, was specifically to offer an environment that was more cost effective to do these procedures than in the hospital setting, where the cost is at least double. And so, because these procedures can be done as an outpatient in a special regenerative medicine therapeutic suite, which is nice. And so I think that, so we bundle care, we make it more cost effective because we can control that cost in our own private clinic. And I think that's what a lot of physicians are doing. Most of these procedures are done outside a hospital setting. And so just because the cost is just so high, but we've got it to, the way I tell patients is, like you said, this is an investment in your health, and it's really no different than the out-of-pocket expenses if you went for a spinal fusion. They don't get that, right?
Right.
So, your insurance doesn't cover everything. These surgeries and hospitalizations are $100,000. It's a lot of money. So your out-of-pocket expenses are very high. And so I think that that's one way of giving perspective.
And in the recovery from it, you're probably losing something out, whether it's not being able to go to work. I mean, there's a loss, whether it's a transactional loss of some kind, whether it's dollar amount or enjoying life and your energy. So I think this is kind of like one of those, if you can do something to help you that is not is cutting you open, that is like a very, that is, I love this whole idea of regenerative care. So regenerative care, do you see this like being its own kind of umbrella in years to come, or is it already in that position?
It's good. Regenerative medicine is probably the fastest emerging field inside medicine currently, not just for orthopedic conditions, but for other, neurologic conditions and, cardiac. I mean, it's really interesting. And I think it's going to be a kind of an interdisciplinary specialty that is going to be subspecialized in orthopedics or cardiology, those sorts of things. But
and regenerative regenerative just defined means that you're doing something that's helping your body heal itself. Is that
correct?
How you would say? Okay.
You're using your, under the current FDA guidelines, we're allowed to use your cells from you on the same day with what's referred to as minimal manipulation, meaning we can centrifuge them and concentrate them, but we really can't culture them in a lab and put them back into you. We can't take other people's cells and put them into you. Those sorts of regenerative treatments would have to go through a full FDA trial. But PRP, since it's a blood product that we take the same day and it's yours, it's not considered a drug. And as long as you are operating under those guidelines, we can treat you right now in what's called off-label fashion, meaning, in the trusting doctor-patient relationship, if we think this is your best, safest option in 2023, in the confines of my office, I can say, I think intradiscal PRP is your best option for degenerative disc disease. As a company, if we have a company that's making a claim without an FDA trial, you can't do that. Yeah. But a doctor or physician we can treat in that mutual trusting relationship. And that's basically, we've treated well over 1,000 patients, and it's all in an off-label fashion, but it's all through just word of mouth, patients explaining it to them. And most patients that come to me have been told by one or two surgeons, you need a spinal fusion, and they're coming to me for the alternative. Mm-hmm. And so it becomes a no-brainer when the patient's looking at a very invasive, risky, uncertain outcome spinal fusion versus a simple outpatient hour injection of your own cells. And even if it didn't work, you don't burn bridges.
Right.
And then from a safety standpoint, it's been extremely safe. We worry about infection. Like, that's our primary concern. But what's interesting is by using a type of PRP with millions of white blood cells, we haven't had any infections using a leukocyte-rich PRP in the disc, which is really incredible. Not saying it can't happen, but we do all the steps to mitigate against it. And the infection rate with fusions is so much higher. It's really, think about that. If the newer data is saying that our spines already have bacteria present, putting an implant in that area is just going to increase the risk for biofilm and infections. And what most people don't realize is that, when the spinal surgeon says my infection rate is 1 or 2%, that means patients who have really bad infections, meaning they have fevers, chills, wound drainage, like really bad, sick infections. But there's another type of infection that most people don't realize. It's called occult infection, which is a localized infection. And that's where when the implant is placed in the body, there's like a race to the surface. It's between normal cells to incorporate the implant or bacteria. And if bacteria win the race and create biofilm, then that implant never gets incorporated. And it's just a source of pain because your body is constantly attacking that foreign object with inflammatory proteins to try to get rid of it. But when there's biofilm, you can't get rid of the bacteria. So the only solution is to take the bacteria out. And there was a recent study at Hospital for Special Surgery by my colleagues, Frank Camisa and Celeste Abjornson. And what they did was they took those implants out from all these fusion patients that had persistent pain of unclear etiology. And they sonicated the surface and they cultured the material and found that bacteria were present in over 40% of those patients. And so, this is a huge problem that's been underreported. And I think that my advice is to think really long and hard a bit before going for a spinal fusion for degenerative discs.
Yes,
If
because
somebody's got a fracture that's unstable or a severe deformity that needs to be corrected, that's what these devices are made for. But it's really not made for degenerative disc disease.
oh, I'm so glad you brought that up, because again, I think when it's presented to the layperson, because that's often who the people are that are coming, it seems like this is it's like, let's just glue this together and then you won't have this instability or pressure on your, and it sounds like, oh yeah, that sounds great. And I don't think people realize, yes, all of these, there's a lot of consequences that wouldn't be ideal. And that, like the bacteria one alone, like even the fact that your body is spending this energy fighting this foreign object, it's like energy that you might not have a fever, but you might feel tired. You might be drained because it's like your body is having some kind of inner conflict that is not necessary. So I love that you're doing this. Yeah. Go ahead.
And a lot of those patients, I'm sure you've seen them, are on opioids. And so they're taking opioids for month after month, and because they can't get off of them because the pain is so bad. And there's one study that showed that over 60% of patients after spinal fusion surgery are on opioids 3 months after their fusion surgery. So how is that a cure? How is that helping them? And I think now we're understanding it's really most likely from biofilm on the implants that's causing the pain, and that's the number one cause of loosening of spinal implants now is biofilm. So
biofilm meaning it's bacteria that is just kind of hanging, like it's like taking root. Oh my gosh.
It's like think of biofilm as like a force field that's protecting the bacteria from getting killed by our natural immune system.
Oh wow.
That's what it is. It's a force field. It's a protein layer that forms on the implant. And so,
well, I love your message. I think everybody listening, probably everyone listening knows of someone, if it's not yourself, everyone knows of somebody who's had low back pain and probably falls into the category of some kind of, disc issue. So check out this book, Heal Your Disc, End Your Pain. That is like such a great title too, which I'm sure took a while to come up with because that's like very succinct. But then you really go into anything else you want to say about the book, why people should buy it, how they should give it to somebody, and how people can, like, we have people that listen from all around the world. They aren't in New York. How can they get this if they need it somewhere else in the world? Do you have any satellite clinics or sources where people can find doctors who are doing this ethically?
There's a chapter in the book that goes through how to research interventional physiatrists or interventional orthobiologic specialists. And there are people doing this around the world. It's starting, the paradigm shift is already occurring. And this is not just a problem in the U.S. This is a global problem. Back pain is the number one cause of disability in the world. And it's been estimated that there's 580 million people in around the world with chronic lower back pain.
Whew.
And if you think 50% of that is from a problem with a disc, then you can see how large a problem is. But that's what's so encouraging about the message of the book is that I think we finally have a solution for patients that can be scalable and safe and opioid sparing and avoiding spinal fusions. And so I think, I'm very excited about it. And I think hopefully the book was written with the intent that it would be understandable to the lay or scientist. And so far the feedback's been very good. And I think you can buy it on Amazon. I did do the Audible version that comes out in a few weeks. So if you don't want to read, the Audible version is going to be out shortly.
Amazing. Well, thank you so much for your time. I know you're very busy, very accomplished, and very passionate. And I hope that I see you very soon and really see this wave turning of getting into this regenerative medicine that we just need. We need a different approach, and we need one that really feeds into this natural healing that we all have in our bodies. And I think it would change not just our attitude, get rid of the pain, but also this idea that our bodies are working for us, and we're just going to give it some tools to do that. There's so much more to add to that. Like, I think ageism and all of these things contribute to the mindset, and I think this can really shift everything. And I hope that happens sooner than later.
Well, thanks so much for having me and giving me the opportunity to share the message. And it's an important message, and I think that if people have a difficult time maybe finding an interventional spine practitioner that does regenerative medicine, they could always check out, the Regenerative SportsCare Institute in New York. People come from all over the world. And, the website is regensportscare.com. And we're happy to evaluate your candidacy for the procedure or refer you to someone who we might know who's good in your area.
Oh, that would be great. I think that's very nice when you get the recommendation from the top. So everyone check that out. That'll be in the show notes. All this information, go buy the book, take care of yourself, believe that you can get rid of pain and feel so much better and function and live with more joy. So thank you for being on here today.
Thanks again.
All right, everyone. As always, I'm pulling for you.